Welcome, dear friends. I hope all of you will be fine. According to a new study's lead author, Professor Predrag Mitrovic of the University of Belgrade School of Medicine, there have been very few studies analyzing the effects of music on heart conditions. He said, based on our findings, we believe music therapy can help all patients after a heart attack. Not only patients with early post-infarction angina, it's also very easy and inexpensive to implement. This new research is due to be presented at the American College of Cardiology's 69th Annual Scientific Session and Expo, scheduled to begin on March 28 to 20. According to this study, only 30-minute music a day can significantly reduce the risk of further heart problems for people who have experienced a heart attack. Let's go in deep. 1. About heart attacks. According to a report by Centers for Disease Control and Prevention (CDC), every 40 seconds someone in the United States has a heart attack. Heart attacks can be lethal, particularly if they happen outside of a hospital, but many people recover. A significant number of these people experience anxiety and chest pains in the first 2 days after the cardiac event. The CDC also points out that a person who has had a heart attack may have a higher risk of a future heart attack or cardiovascular disease. Treatment for a heart attack depends on the type of attack and factors specific to each person. According to the American Heart Association (AHA), it may involve various procedures and prescription medications. 2. About this 7-year study. In this new study, 350 people had been experienced. They suffered a heart attack and had post-infarction angina, chest pain that follows a heart attack. Half of these people received only the usual treatment, while the other half received this usual treatment along with 30 minutes of music therapy per day. The music therapy was tailored to each individual. First, the researchers played 30-second clips of different types of music to each person and determined how calming each type was by measuring the dilation of the person's pupils. After deciding which type was the most relaxing, the researchers worked with each participant to select the most calming tempo and tonality. The team then asked the people in the music therapy group to listen to the music for 30 minutes a day, at any time that was convenient, preferably with their eyes closed in a calm environment. This continued for 7 years, with the music therapy participants regularly filling in along of their experiences. All of the participants had follow-up assessments every 3 months for the first year, then once a year for the remaining 6 years. 3. Result of 7-year study. After the 7 years, the researchers found that the people who had music therapy as well as traditional treatments were significantly less likely to experience anxiety, pain sensation, and pain distress than those who only received traditional treatments. On average, the music therapy group had 1/3 less anxiety and 1/4 less angina pain than the regular treatment group, based on scores. Moreover, the researchers found that the people who received music therapy were significantly less likely to experience a variety of heart conditions. This group had 80% less heart failure, 23% fewer heart attacks, 20% less need of coronary artery bypass graft surgery, and 16% lower incidence of cardiac death. Professor Mitrovic speculated that music therapy may achieve these effects by reducing a person's fight or flight response, which puts additional measure on the heart. He said, unrelieved anxiety can produce an increase in sympathetic nervous system activity, leading to an increase in cardiac workload. This is it, guys. I hope you like the video. Thanks.